Good afternoon, everybody from Ghana. I am Dr. Folashade Ojo-Benys, and speaking with me today is Abraham, and we are from Lene Services. So I'll let Abraham start with the conversation, then I'll take it up from there.
All right, so we are going to talk about thriving in healthcare. That's the West African job market. Now, the agenda or the outline for today, we are looking at specifically about 7 items on the table today. So we are going to look at the overview of the healthcare industry in West Africa. We are going to look at the job market landscape, essential skills required, competencies required, challenges that are faced, and opportunities that are available for healthcare practitioners within the industry. There are a couple of case studies that we are going to look at, how to stand out in the job market from school and from pursuing the careers or the educational certificates. How do you stand out once you are on the job market? And then there are going to be interactive sessions. There will be time and opportunity for questions and answers. And then the concluding remarks will come in. I'm going to take a few of the slides, and then Dr. Fola would also come in and then continue. And so we can move to the next slide and then look at how the healthcare industry in West Africa is rapidly evolving. Now, as a result of population growth and urbanization, healthcare is growing quite fast. Now, it's not just the population that is also accounting for the rapid growth in the healthcare, but technological advancements are also helping to increase the speed at which that industry is also growing. There's global health challenges, which are resulting in the growing recognition of health as key to sustainable development. Now, regardless of the stage in the educational sector that you find yourself, it's very important to understand the job market landscape, because once you do that, it positions you to be able to find and then to also locate yourself within the right frame or the right place of work. Now, to look at the next step, the next slide. Before that, I want us to also cast our minds back to the COVID-19 epidemic. We all can remember how the COVID-19 epidemic accelerated digital growth. And so when you look at Ghana, we have the Zipline, which is also now delivering medicals to rural areas. This is as a result of technological advancement. Now, in this particular session, we are going to explore the following items. We have the job opportunities and demand. We have essential skills for career growth. We have the challenges and then the solutions. And then we are going to look at the role of technology and global health initiatives, strategies for thriving in the health industry. We can move to the next slide. Now, when we take a look at the health industry, it's quite vast and it's quite broad. Now, there are key sectors in the health industry. As a consultant, I've worked on several roles for my clients, recruited different levels of health practitioners for my clients. And amongst them, we have a few of them that are noteworthy. We have the clinical roles, which includes the doctors, the nurses, midwives, scientists, and other allied health professionals. We have the public health, and that looks at the health workers, it looks at health program managers, and then it also looks at some kind of specialist as well. We have the adjacent roles as well, which is made up of the administrative roles, including the hospital managers, health insurance experts, policy analysts. And then we also have the digital roles, which have to do with data analysts in AI. And then we have the telemedicine experts as well, which is also growing quite speedily. We can look at the next slide. Now, in terms of growth trends in the healthcare sector, we know that in West Africa, the healthcare industry is expanding quite rapidly. Now, we mentioned population growth earlier, and we know that in terms of the population growth, West Africa's population is projected to reach about 800 million by 2050. Now, this tells you the number of um, healthcare needs that will come up within the few years to come. Now, once the population is growing, there will definitely be need for health medicinal care for all the human beings or all the people who would need the healthcare at one point or the other. There's also urbanization, which means that more people will need healthcare once the cities are growing and the cities are increasing in population. Now, funding is also becoming very important. And so we all know what the World Bank and agencies like the USAID have been doing in terms of supporting health growth and then providing funds to undertake a lot of research and vaccines, mental health issues, maternal health issues, and then non-communicable diseases as well. We can look at the next slide. Now, these are examples of organizations that we can take a look at in terms of the overview of healthcare industries in West Africa. Now, the rise in telemedicine, health information, and then AI-driven diagnostics. These are the areas in terms of technology and AI that we can also cast our eye to. Now, it's not just limited to the clinical roles. If you are in the healthcare industry, you can also branch into these areas to be able to make yourself available for all the new roles that are coming. Now, we know that organizations like PEPFAR and then Global Fund have invested over 5 billion in malaria and HIV programs. These are in the forms of research, which is creating jobs and healthcare professionals for the industry. There's also improvement in healthcare infrastructure. In Ghana, over the past 8 years, there's been serious advancement when it comes to healthcare infrastructure. And once the healthcare infrastructure is also increasing, it creates job opportunities for the healthcare professionals who are leaving school and even those who want to take it on part-time basis. We can look at the next slide. Let's move to the essential skills and then jobs. And then Dr. Fola would also take a look at the job market landscape. So Leila, if you are the one controlling it, kindly move to a few slides below. I want to look at the essential skills and then the competencies. Now, once you are in school, what happens mostly is that we are given the technical education. And so we learn all the clinical roles that we need to administer to healthcare patients. Now, there are essential skills that are required if you are in the healthcare industry or if you're a professional. Now, these are a few of them that we have here. But then I want to speak to a few of them from interactions with some of our clients in terms of the HR services that we provide for them. Now, in our interaction with some HR or clients within the healthcare industry in Ghana, there is a need for certain skills. One of the challenges that they face in that industry has to do with leadership and management from healthcare practitioners or professionals. Now, the first clients that we engaged as a company in terms of recruiting for them highlighted issues like problem solving, professionalism. When it comes to even putting up a CV to look for a job, it's a very important skill that you need. Now, what they realized over the years is that a lot of the professionals from the educational background do not come up with very attractive CVs. Now, once your CV is not good enough, some recruiters will not even take a look at it. And so the skill to put a CV together is highly essential. And so if you are a healthcare professional, if you are in education, there's need to invest some time in the preparation for interviews, in the preparation of your CV. Now, once you are done with preparing the CVs, there is need to go for an interview. And then you need to have something we call the mock interviews. Now, we know that in Ghana, the healthcare students move straight from school after they are done into the work environment, because government recruits quite a high number of the professionals from school. And so that's the reason why we find that a lot of the professionals from the health academic background are not preparing so well for interviews and also putting together very good CVs. Now, as Lineage Services, we are positioned to be able to help with some of these things. And so we can put together a good CV for you, even if you are in the health industry. Now, we can also help to groom you for interviews that you'll be going for in terms of jobs when you are seeking jobs in the health industry. Now, to talk about leadership, now they have observed that quite a number of the health professionals who come into the sector lack leadership skills. And for this matter, it is important that once we are learning all the technical roles in terms of the clinicals and then the administration, we learn a bit of leadership, a bit of professionalism in terms of how we relate with the patients, in terms of how we mobilize our team members and manage them into achieving the goals that are set for any department that you find yourself in. Now, apart from leadership, there is also the need for us to also enhance our communication skills. Now, all of these things, there are courses that we can take aside the technical courses that we are taking in school. And so Dr. Benny would mention a few of them as she takes over to introduce some of the courses that you can take and the certifications that you can take in order to enhance your skill whilst you are coming into the job market. And so Dr. Bene would come in because she's the expert. She's going to give us, elaborate a lot more on some of the practices that we have here and the information that we have here, and give us practical examples with regards to the job market where the health care industry is concerned. And so, Leila, I'm passing over to Dr. Folashade to continue from here. Thank you.
Okay. Thank you, Abraham. Leila, please, can you go back to the job market landscape? Okay. So thank you. So we'll look at the job market landscape for the West African region, and I'll be referring to some of the countries who are doing very well in terms of healthcare job demand, creating demand for healthcare professionals. So there's an increasing demand for healthcare professionals in West Africa at the moment, and there are a number of factors that has actually led to the demand for healthcare professionals. And when I say healthcare professionals, I'm referring to doctors, nurses, pharmacists, public health experts, the administrators, even finance managers, health informatics, and digital health. At the moment, we have WHO has come up with data that stated that we have a shortage of over 1 million healthcare workers in the West African region at the moment due to migration, due to brain drain. So we have a lot of doctors and nurses actually leaving West Africa to the Western world in search of better opportunities and better jobs. So this has actually created a demand for professionals in this area. And also because of the increased need for pandemic response, we all knew what happened during the COVID, and Abraham has mentioned some things in relation to the COVID. So because of this increased need for pandemic response, for community health services, for epidemiology, there's an increased demand for public health experts. There's also an increased demand for health administrators. And this is as a result of growth in hospital management, insurance policies, and also policy making, which has led to proliferation of both public and private health facilities. So therefore, there is need for health managers. And then because of the growing or emerging area of health informatics and digital health, where we have AI, telemedicine, and then the use of electronic health records, there is an increasing demand for health informatics and professionals in digital health as well. Next slide, please. So we have some factors that are actually driving the demand for healthcare professionals. And these include the rise of non-communicable diseases. In the past, we used to have more of communicable diseases in Africa as a whole, but now we are being saddled with a double burden of diseases, which include both the communicable diseases like malaria, HIV, tuberculosis, and now non-communicable diseases like diabetes, hypertension, cancers like breast cancer, prostate cancer, which are on the rise. And because of these, there's increasing demand for specialists in these areas who can effectively manage these cases. There's also persistent shortages of nurses and midwives, like I mentioned earlier, where we have more than 1 million nurses and midwives leaving the region. The pandemic preparedness, vaccination drives, and community health initiatives, they have also created demand for healthcare professionals who have versed in these areas. And also, in recent times, there's been an increased recognition of mental health disorders. So we have a lot of people with anxiety disorders, we have people with depression, we have people with who are battling with drug abuse, and even suicidal ideation, and a whole lot. So this has also driven the demand for specialists in clinical psychology, in therapy, and then in psychiatric nursing, as well as psychiatrists as well. Next slide, please. Also, we have digitization of healthcare, which is becoming the order of the day now in the West African sub-region. And this is transforming job roles and creating a high demand for careers in telemedicine, in cybersecurity, in health data analytics, and also in AI. And this has also led to strong governance and policy leadership because there is need to protect data. So this is also driving a lot of investments into healthcare system and improving the current healthcare system that we have in the West Africa sub-region. So there is job demand actually for policy makers or analysts who are well-versed in these areas. There's also universal health coverage expansion, which is also increasing the demand for health insurance and policy analysts. We are trying to ensure that all people, irrespective of age, irrespective of sex, irrespective of socioeconomic circumstances, have access to quality healthcare in the West African sub-region. So therefore, this is actually increasing the demand for both public and private health insurance companies and policy analysts. And additionally, our private hospitals and health organizations are currently hiring skilled hospital administrators. So it's no longer business as usual. Now there is need for skilled hospital administrators to actually manage all these evolving health institutions in the West African sub-region. There's also the demand for local pharmaceutical manufacturing, especially as a result of the insights that were gained during the COVID-19 pandemic, where we experienced shortages in pharmaceutical products and had to depend on foreign aid. So this has driven the demand for local manufacturing industries within the West African sub-region. And once these industries are created, there is need for skilled professionals to work in these industries. Next slide, please. So when we look at the job market, there is need to look at what remuneration or salaries will be paid in whichever job market or the sector you find yourself. So we have in West Africa currently, we have the public sector and we have the private sector, and they have their advantages and their disadvantages. We can also refer to them as the traditional job market and the non-traditional job market. So for the public sector, which is the traditional job market, that's where you get employed by government agencies. And in terms of the salary, it actually pays less than most of the private healthcare jobs. and even much lower than the non-governmental organizations. At least about 30 to 50% less than what you get if you are in the private sector or you are in the NGO sector. And however, there are advantages to this public sector engagements because one, it provides some form of job security. You know that the industry, the organization will not fold up or will not be hit by taxes like what Abraham mentioned earlier, and other factors that can actually affect the private industry. So in terms of job security, the public sector is actually better, and it also offers career growth. For instance, if you are a doctor in the private facility, in a public facility, there are career patterns which are laid out for every doctor, every nurse, every pharmacist. In fact, even the administrators and finance officers, there's a career pattern for you that they expect you to attain within a certain period of time while you are employed. So if after a year of finishing your housemanship, that's after medical school, you go through housemanship. After your 2 years of housemanship, you are expected to get an employment, that job openings, you get employment into the government sector. After a year, you expect to start your journey into specialization. So you determine the career pattern you want to follow, and then you apply, you get your residency training, which will be funded anyway, and then you start towing that line. The same thing with the administrators and other cadres of staff in the healthcare profession. So this gives you some form of growth in your job. With a private facility, it's all dependent on what the private facility is looking out for. For instance, if your desire or your goal is to be an oncologist, if the private facility has employed you as a medical officer and all they do there is obstetrics and gynecology, it will be very, very difficult for you to to progress in your career into becoming an oncologist in such an institution. So even though they will offer you a higher pay, they will offer you benefits, but it is all dependent on the demand in the facility. Another emerging area, like I mentioned earlier, is telemedicine and the remote operation when it comes to healthcare now. So currently we have doctors and pharmacists and administrators, AI specialists, data analysts working remotely. They earn more because it gives you opportunity to even take on more jobs. However, like I said earlier, it's still dependent on the organization you work with. So currently, we have countries that are leading in healthcare jobs. For instance, we have Nigeria, which has the largest healthcare system. And like I also mentioned earlier, we are still having challenges with brain drain because we have a lot of people leaving the system. Ghana is also expanding in universal health coverage, and this is creating more jobs in the rural areas or the peri-urban areas as well. Senegal and Cote d'Ivoire are also developing medical tourism and making it a place where you can actually go and get healthcare. So instead of going to the Western world to get healthcare, you can actually stay within the West African region and get adequate healthcare like what you will get elsewhere. Next slide, please. Next slide. So Abraham has talked about the competencies that are required. Can you go back to the previous slide, please? Okay. So in terms of career growth, like I mentioned earlier, there is need for certification. There is need for education. So you start your career from your undergraduate level. Like I know some of us are currently undertaking some form of degree, first degree, and then you can progress to a second degree, which will be your master's. You can go ahead and get a PhD. But most importantly, like what Abraham said, is not just enough to have technical skills. There are other soft skills that you need to acquire, and these you can get from other learning platforms. You can get from other qualifications. For instance, as a medical doctor, if you are interested in administrative work or being a healthcare manager, you need to go beyond just your technical skill that you have acquired through your residency training or through your fellowship training, and take on other courses like health administration, clinical leadership in health, public health management, and so on. And you can actually get all these through master's degree courses. You can get diplomas, you can get certificate courses, and you can also learn through the continuing medical education and continuing professional development programs, which is very, very key and very important. And another area that is important for everybody who is in the healthcare space because of the emerging and evolving environment now is to get some form of certification when it comes to health informatics and even AI technology. It is very, very important to have digital skills to be able to actually stand out in the healthcare job market. Next slide, please. So in terms of the career pathways and progression, like we've been saying, the job market is evolving and the professionals must balance their education, their experience, specialization, certifications, professional development, and networking to remain competitive. So when you look at it, is it the education that matters most or the experience that matters most? It depends on your career pathway. So if, for instance, all you are interested in as a healthcare professional is, for instance, to be a nurse who is discharging nursing care to patients, you may not need to go beyond a certain level in your career goal. You may not need more than your educational background to progress in your career. But if you are interested in taking on not just the clinical role, but also administrative role, then you will need to add on to your education and also gain experience as well. So for clinical roles, definitely you need education. And if you are going into public health and administration, you will need both education and other qualifications as well. And this is where the private organizations value skills, which is not just the technical skills, but they value the other skills like the soft skills that Abraham mentioned earlier, and also experience more than the degree you have acquired. Because if you have if you are a master's holder in health administration and you lack, you haven't worked as a manager anywhere before, you may not get the job if there is somebody with a first degree in health administration and with 10 years experience in managing a healthcare facility. That person will definitely get that job and you may not get that job. So it's very, very important to balance both the education, the certificates with experience, and also some other soft skills. So gaining relevant work experience is crucial for career growth. And this you can achieve through internships. So if you need to gain experience, you can volunteer in a place where you can learn directly from those who have been in the job for some time. And these are some of the areas where learning services also come in to give advice and to also show you how to go about it to make yourself marketable. And then residency programs, clinical rotations, field work, hands-on training, they are all very, very important areas where you can gain relevant work experience. And these experiences will accelerate your career advancement. And as employers, they value real-world impact and a strong portfolio as well, especially now that we are in the digital world. Next slide, please. So Why do we think specialization and certification matter in healthcare? It's because it enhances job security and salaries. So if you have certifications to boost your area of specialization, then it makes you, your hiring potential increases and you can make advancements in your career. Another important aspect of the progression in your career is networking. Networking is very, 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 very important. It cannot be understated. It is very, very important. And most of the people who get good jobs, they actually get them through networking and good marketing. So more than 80% of healthcare jobs are actually filled through networking rather than public job postings. So by the time you see the job posting, somebody who has been able to network effectively will get the information first and apply for the job, get the chance to get interviewed, and then probably get the job faster than you that you are waiting for the posting of the job. So the right connections can actually lead to job referrals, can lead to mentorships, and also research collaborations, which is another evolving area in healthcare in the West African sub-region at the moment. So likewise, professional associations. So there are a lot of job postings that you will find by just by belonging to a professional association, by attending conferences, by engaging on LinkedIn, and also by publishing in peer-reviewed journals. So you can actually, if you are into research and you don't just sit on your findings, you publish your research findings in peer-reviewed journals, it can actually open up a lot of doors for you where you get people contacting you for job opportunities as well. And also finding the right mentors can also enhance your career opportunities in healthcare. Next slide, please. So with all the opportunities that are there are quite a lot of challenges in the West African healthcare sector. And we have a high demand for medical professionals or healthcare professionals in the midst of workforce shortages and challenges, because we have the challenges with retainership. So in as much as there are opportunities, there are challenges. So we have shortage in workforce at the moment, where I'd mentioned earlier that we need over 1 million additional nurses and midwives alone, not to talk of the other areas. And one of the reasons why we are having these shortages is because of the low wages that are being paid. We have poor working conditions, there are limited training opportunities, and also limited funding. So these are areas where there are challenges. And I personally believe that where there are challenges, that is the same place where there are opportunities to actually grow and take advantage of the challenges and develop yourself in the midst of all these challenges. We also have brain drain, which is leading to loss of healthcare professionals. And because of this, you have fewer healthcare professionals, especially when you look at the clinical areas, the pharmacists, the laboratory scientists, the doctors, the nurses, and midwives. Because there are fewer numbers, the doctor-patient ratio, the nurse-midwife-patient ratio becomes higher. So therefore, patients have to wait for a longer period of time before they can get to see a doctor. And this has actually created opportunities for those who are thinking through to come up with innovative ideas like remote consultation. And this is actually opening up the market in this regard. Also burnout as well, which is causing a lot of mental stress and mental health challenges for the available professionals, and rising cost of healthcare as well. We have the healthcare entrepreneurship as well, which is facing several challenges like lack of funding. So someone has a beautiful idea of operating his or her own private health facility to augment the public health facility, but without funding, it becomes a challenge. And also the delay in regulatory processes. For instance, I always say that we have great policies in Ghana, especially when it comes to healthcare, but our major challenge is with implementation of these policies. It's actually a slow process. And our rural environment as well, the rural areas, the peri-urban areas, they're also limited in terms of technology that is available, unlike in the urban areas where you have technological advancements. There's also high operational costs due to inflation and the fact that there is a gap in local manufacturing production of medical equipment and supplies as well. Next slide, please. So what are the solutions to these challenges? One is looking at policies whereby salaries can be improved. We have expanding medical education where there are opportunities, like I mentioned earlier. For instance, if you're a doctor or you're a nurse and you are working in the public sector, you get some form of scholarship to go back to school to advance in your career to become a specialist in your chosen field. So this come in form of we call it steady leave with pay. Okay, so when you have a steady leave with pay, you can actually go to school and get your salary on a monthly basis, get your allowances that are due you on a monthly basis as well. And you will not lose out on anything. And at the end of the period, you get to expand in your career, you get to progress in your career. The other way that government is trying to ensure that those who are being trained are not also leaving the system is by ensuring that the medical or healthcare professional is bonded to the system. So you sign a bond form when you are going to pursue or to advance in your career, so that once you are done, you can come back and give back to the system. Also, in Rwanda has an initiative called Homecoming Health Initiative. So they implement returning incentive programs for all their healthcare professionals who go outside the country to actually acquire further certification or progress in their career. And then when they come back, they have packages for them, increased salary, they have accommodation and other attractive initiatives that keep them in the country as well. The other aspect is also using telemedicine to bridge the gaps, healthcare grants, and then partnering with governments and NGOs. So that's more like a public-private partnership whereby private institutions can actually set up facilities and hand it over to the government agencies. And also mobile or offline solutions like the telemedicine or remote consultations as well. There are several organizations or several countries that have actually used this initiative to promote and to reduce their mortality rates. For instance, when you look at Rwanda, again, Rwanda has this baby health telemedicine app, and from their record, they've been able to consult for over 1.2 million patients via their mobile phone apps. So they don't have to go to the hospital to go and wait in long queues, and they are being seen. And this reduced their hospital congestion by 30% in a year. Next slide, please. So what are the opportunities in the healthcare space? We have business opportunities, and it has been postulated or has been projected that by the year 2030, the West African healthcare markets will reach a value of about $259 billion. And this is very, very important, especially when you look at entrepreneurial opportunities. So, like I mentioned earlier, public-private partnership can actually come into this space and create opportunity if a private organization is able to provide a healthcare infrastructure, it can give that over to the government facility, and from that, create job opportunities for people and make a lot of money from that. So there is a pressing need for hospitals, for clinics, for diagnostic centers in the West African sub-region at the moment. The same goes for the healthcare logistics and medical supply chain management. So our health administrators, there are a lot of job opportunities in these areas. We have procurement managers who are well-versed in the supply chain management, who can provide services to this new infrastructure being developed. We have pharmaceutical companies who can also locally manufacture drugs and therefore provide job opportunities to people in the pharmaceutical space, and also make money from this as well. Also with the health insurance services. So a large proportion of the population, they lack in health insurance. So if we have innovative models that can provide affordable and accessible coverage, it's also an opportunity for people who are interested in this regard. So we have Reliance HMO in Nigeria, which is an AI-based health insurance platform that allows small monthly payments of premium on weekly basis and even monthly basis for those who are salary earners. And this way, it increases the coverage, the insurance coverage in the low-income communities by about 40%. So this has created an opportunity for business in this regard. Next slide, please. So we have technology and startups as well, where we have telemedicine and virtual health, where the remote doctor consultations are providing healthcare services in underserved areas. In the rural communities, a lot of doctors, a lot of nurses, pharmacists, healthcare professionals, they are reluctant to go and work in such areas. Everybody prefers to work in the urban areas. But these underserved areas, they need healthcare. So this has also created a demand for healthcare professionals in this environment. So taking the advantage or using the advantage of telemedicine and virtual health has created opportunity in these areas. And we have platforms like Zuri Health that offer virtual consultations, which connect patients with healthcare providers remotely. And these help to overcome geographical barriers. So this has been piloted in some countries and it is successful. And this is also an opportunity for those who are in the telemedicine space or the digital health space to create similar solutions in other West African countries, or even extending it to other African countries as well. And this will create or open up the job markets for other people who are in this same space. The digital health records as well. Now, West Africa has advanced to digital health management systems. So we have almost all the hospitals in our West African sub-region enrolling onto different electronic medical record system. And this is creating a lot of opportunities for those who are interested in this area. We also have the mobile health applications where we have even the AI-powered diagnostics, where you can have things like on-the-spot testing. So you get your diagnosis right there in the consulting room, and all these are AI-powered. We have AI-powered prescribing apps as well. So all these actually increases or enhances patient engagement and self-care. And right now in the healthcare industry in our West African sub-region, customer service has also infiltrated into it. So you see that healthcare facilities that have good customer care services are actually thriving. So they get a lot more clients than those who are still struggling to get on board and follow the current trend. So it's actually helping. You can sit in the comfort of your home and get an appointment, schedule an appointment to see a specialist or a doctor without having to go to the healthcare facility to book that appointment. You can get AI apps that can analyze symptoms for patients. They detect the diseases early as well. And then we have home care and assisted living as well, where we can offer services to those who are elderly or those who are disabled or impaired and are having challenges accessing healthcare directly. Next slide, please. So we have a few case studies of top healthcare startups and innovations in West Africa. So in terms of telemedicine, we have the Mobi Health in Nigeria, which provides 24 hours, 7 days a week doctor consultations. So you can just log on to the app and then you get to talk to a doctor. If you need to get prescription, the doctor can link you up to another service that can give you that prescription and even deliver it to your home. If you need a doctor to visit you in your home, you can also get that consultation done. And this can be replicated elsewhere, creating opportunities for everyone. We also have Zipline, which was piloted both in Ghana and Nigeria and is currently thriving. And what Zipline does is to use drone to deliver blood and vaccines to remote areas. These are major challenges in the West African sub-region because of shortages of blood supply. So where you have remote areas who do not even have accessible blood banking services, with Zipline, a call is made and then they locate the nearest healthcare facility that have the blood that is needed for the particular patient, and the blood is delivered in record time. And in Ghana, for instance, the Zipline has been able to reduce the emergency blood supply delays by 65% in 1 year. And in more than 50 healthcare facilities, drone has been used to transport vaccines and medicines in record time to patients who need them urgently. And it has also created jobs for drone pilots, for logistics coordinators, for healthcare managers, and even for AI engineers. Next slide, please. We have Helium Health in Nigeria as well, which is currently Africa's largest electronic medical records company. And right now in other West African countries, there are also a whole lot of electronic medical records company that has come up based on the success of Helium Health, and they are also thriving. And in Ghana as well, we have the National Health Insurance Scheme that just piloted a telehealth platform, which is an innovative platform for Ghana, especially in the public sector. And this is currently ongoing in some of the healthcare facilities in the country. And for National Health Insurance holder, those who have the card, they are able to access and even get their medications without actually visiting the hospital, joining a queue. I mean, it's a very beautiful initiative that is actually creating opportunities for doctors and nurses and even pharmacists who are interested in telehealth. We have our health insurance and fintech solutions as well, like the Reliance HMO that I mentioned earlier. We have M-Pharma, which reduces the cost of medications by negotiating bulk purchases. And therefore, they end up providing low-cost medicine subscriptions to families who are not able to afford the expensive medications. And they've partnered with more than 1,000 pharmacies across Africa. And you can imagine the number of jobs that have been created through this. Next slide, please. We have also successful entrepreneurs in the health space. We have 54Gene, which is in Nigeria. And what they do is to establish a biobank and research institute to look into healthcare research when it comes to the African population. Most of the time, we depend on researches done in the Western countries, and we use that as a basis for some of the decisions we take. But right now we have a research institute within our African setting, and not just in Nigeria alone. We also have Noguchi in Ghana, which are which are conducting researches in African populations, and these are all the avenues for creating job. We have Negos Med in Ethiopia, which is also working in the peri-urban health centers, and they offer access to advanced surgical and medical equipment through a pay-per-use model, more like a public-private partnership as well, whereby they provide the equipment to the healthcare facility, and then they have an arrangement of payment and while they use the equipment, especially in situations where such facilities are not able to afford those equipment. We have Ilara Health in Kenya, which provide affordable diagnostic equipment in the rural areas, especially those areas that are underserved. And they are using AI and robotics to enhance diagnostic capabilities, which will allow early disease detection. And once the diseases are detected early, you can be assured of better patient outcomes. Next slide, please. So how do you stand out in this job market, this evolving and thriving job market? One is the lifelong learning and skill development. It is very, very important to stay abreast of industry trends. And you need to consider additional certifications or courses to enhance your expertise. So if, for instance, you are a doctor and you want to be a healthcare manager, it is not your certificate as a doctor that will get you into that space. You need to develop skills in healthcare management. You need to seek other professional certifications in healthcare management. You need to be thinking of things like health administration. If you want to take up a master's in healthcare administration, you want to look at clinical leadership in healthcare, you want to even, there are so many places. You want to look at project management. If you are interested in even working with non-governmental organizations and managing projects, you need to look at all those areas. And the same goes for every cadre of the healthcare industry. Whatever career pattern you have drawn or pathway you have drawn for yourself, you need to make progress on a daily basis in that regard. There are so many short courses that can help you grow in the chosen career field. There are certificate courses, there are master's degree courses, even PhD level, depending on the career pattern you have decided for yourself. The other important thing is to seek mentorship. It is very, very important, especially in the healthcare space. Otherwise, you'll be fumbling in the dark. You need to seek mentorship. You need to find out those who have gained experience in this, in the particular career you have chosen for yourself. Find out how they got to where they are currently, and then try as much as possible to get guidance from them and support from them as well, so that it also projects you in the right way in the shortest possible time. The other aspect, again, is networking and professional development. Like I mentioned earlier, it is very, very important to network. When there are conferences, make sure you attend conferences, make sure you attend workshops, make sure you attend seminars that are offering courses or even topics in your area of interest. Make sure you attend all those conferences and workshops or seminars as well. And in this, this gives you an opportunity to connect with people who are leaders in your chosen profession. It's very, very important. It's also important to join professional groups. Very, very important. LinkedIn is important. Professional organizations, they are very, very important. Like we have associations, we have the medical association, we have pharmacy association, we have health administrators association, we have a whole lot of association that you can join. And this will also give you a platform to rise in all these places. There are always job postings, even within these organizations as well, these associations. Also, personal branding, very, very important. You need to brand yourself. Once you define your career goal or the area where you want to, the space you want yourself in, it's very, very important to brand yourself. You need to have an identity as a professional. What are your values? What are your strengths? What are your goals? Once you have that, then you can contact organizations like Lene Services to help you brand yourself, to have a clear personal brand. It is very, very important. And this will project you in the job market. And it will also help you to tailor your job search. You can customize your resume for every job that you're applying for. Because once you understand the organization, you understand what their needs are. If you have qualifications that fit into that need, then you can customize your resume to actually cover for that particular job role that you are looking for. And in healthcare, you can actually have multiple roles. So you can have multiple jobs in healthcare as long as you have the capability or the capacity to carry out the job effectively. You can actually have multiple roles. You can be a clinician, you can be a healthcare manager at the same time, and you can even be an entrepreneur at the same time. You can have your own private healthcare industry or organization as well. Next slide, please. So, in effect, I've mentioned that the West Africa's healthcare job market is expanding due to a projected shortage of 5.3 million healthcare workers by the year 2030. So this is very, very important. And there's also increased investments in infrastructure. So we have policy reforms, for instance, in Senegal, there's a nationwide telemedicine regulation. And this is a whole policy reform that is in partnership with the government sector, both government and private. And digital health solutions are also driving job creation. We have key sectors in the healthcare industry, which include the clinical practice, public health, health administration, health informatics, and telemedicine. And we have challenges which include migration of professionals, shortages in the workforce, and then critical infrastructure and resource gaps in our hospitals and clinics. Next slide, please. So entrepreneurship and innovation are reshaping African healthcare with telemedicine, health insurance, and AI-driven diagnostics, which is led by startups and supported by partnerships. And this is creating a whole demand for healthcare professionals. So we have healthcare professionals and tech roles on the rise, and these require continuous learning, networking, and digital skills. And so to stand out in the healthcare job market, you need to invest in relevant skills, seek opportunities, and actively network. Next slide. Thank you.